Oxitec, a subsidiary of pharmaceutical company Intrexon, is testing a new approach to use mosquitoes to fight this virus. Joining me now is Dr. Janette Nesheiwat and Randal J. Kirk. All right, Randal, so talk to me about just how can mosquitoes be used to fight mosquitoes that are spreading this virus?
Well, we've basically turned the mosquito on itself, and we've done this by engineering a male mosquito, and it's important to remember that male mosquitoes do not bite. And we release a modified male mosquito whose offspring will never survive to adulthood. And so we've shown in multiple field trials in Brazil, in the Caymans, in Panama, that this causes absolutely no other effect in the environment whatsoever. But it's been successful in reducing the population of the Aedes aegypti mosquito by over 90% in every field trial that we've conducted.
All right, so you'd be passing on this mutated gene through mating. What does that mean? So if this proves to be effective, what does that look like? Do you have this mass release of mosquitoes in highly affected areas?
That would be one way to start, yes. I mean, you know, this idea is not new. The idea of using disease vector control, which means, in this case, reducing the number of the disease-carrying mosquito, which is limited to this one, almost entirely limited to this one species, the Aedes aegypti. It's not a new idea. I mean, it should be borne in mind that the United States used to have malaria, and so did Europe. And malaria was completely wiped out of the United States and out of Europe in the 1950s and 1960s by reducing the number, and in this case, actually eliminating the mosquito that was responsible for the transmission of malaria.
And Dr. Nesheiwat, I want to bring you in here because Florida's expanded this travel warning.
Right.
I mean, this is the popular summer travel season.
And that approach is amazing. I'm so happy that that's underway. But we still need to take precautions. If you are pregnant, you are highly urged to avoid travel to the Miami-Dade County area in Florida because there is actually confirmed live virus Zika transmission in that area. And what's scary is that it could be in other areas as well. We just don't know. It can take several weeks to determine and to discover if it's in other areas, but we need funding. We need federal government funding to determine that. We need government funding to help ramp up mosquito control, to provide public outreach, education, to pass out bug spray to help, you know, stop the spread of the Zika virus.
There's so much that's unknown about this, and I think the more unknowns there are, the more scared people get. And when you're saying, okay, so pregnant women should avoid these areas where we are seeing the most cases of Zika, then you have the news in the Olympics that golfers were not going because they were going to conceive children with their wife and didn't want to bring anything home. How long can it live in the system?
Absolutely. So if a male goes to a Zika-infected area, he should wait at least 6 months if he had contained the Zika virus before he attempts pregnancy. That's very important because we have to remember the Zika virus can be transmitted sexually, not just from mosquito bites. And if you have any of the symptoms, if you're a male or a pregnant woman, fever, rash,
yes,
headache, joint pains, conjunctivitis,
go see
you want to see your doctor right away and get tested.
Randal, and where is this going to go next?
Well, we're releasing mosquitoes currently in the Caymans and also in Piracicaba, Brazil. And there in Brazil, the city fathers in Piracicaba have recently announced that their number of dengue cases is down by 91%. So it should be borne in mind that this mosquito does not just transmit Zika. Zika is just the latest sort of sensational arbovirus that has grabbed headlines, but there were 390 million dengue infections in the world last year. And the healthcare cost of dengue alone is around $50 billion per year. That's not counting the mortality and the human suffering entailed by that.
But you have to keep in mind that the Zika virus can cause severe birth defects, life-changing, detrimental birth defects, which we need to remember.
All right, such an important subject. Dr. Janette Nesheiwat and Intrexon CEO Randal Kirk, thanks for being here this morning. Good to have both of you.